Well, it's time again to put a campaign ad under the Verify lens.
Tonight, we're looking at an ad that attacks one of the candidates in the Minnesota governor's race. We've asked John Croman to verify some claims. John?
Hey, Randy, we're talking about an ad by the Alliance for a Better Minnesota, a liberal group targeting Republican Jeff Johnson on the issue of health care coverage.
With cervical cancer.
Now you've met Louise,
My world had stopped.
a cancer survivor in the Alliance for a Better Minnesota ad against Jeff Johnson, the Hennepin County Commissioner running for governor.
300,000 Minnesotans will lose their health insurance under Jeff Johnson.
That's based on an op-ed Johnson wrote in 2014. My first goal as governor would be to apply for a waiver from the federal government exempting us from Obamacare. It's true the state says 300,000 Minnesotans gained access to health care when the Affordable Care Act allowed states to expand subsidized health plans.
And insurance companies could deny coverage for those with pre-existing conditions.
This is based on Johnson's call to return to MCHUP, the high-risk pool the state had before the Affordable Care Act for people with pre-existing conditions.
The high-risk pool for the people who have pre-existing conditions or just can't afford what is out there, and we can subsidize that.
Moving sicker people into a high-risk pool would, in theory, drive down insurance costs for everyone else. People in the high-risk pool would pay more. State health economist Stefan Gildemeister said people in the high-risk pool paid up to 25% more for coverage and predicted the average 40-year-old in Morris, Minnesota would pay far more than he or she does now.
It's expensive, but Minnesotans were willing to pay for that before, and frankly, it was cheaper than what we're doing now and covered almost as many people. I see that as
So we can verify Jeff Johnson wants to change the system in ways that would make health care more expensive for some Minnesotans. But he doesn't support outright denying coverage to anybody. It's difficult, though, to predict what will happen in the insurance landscape now because the Affordable Care Act is being challenged now on many fronts. Back to you.
All right, we appreciate these stories. Thank you so much, John.